Hello, and welcome to Strength Training for Runners, Week 2, Day 3. So last night the video did work out okay. We got home and I thought I lost it again, but for some reason I had it someplace else. Not important. We're going to start, say hello to our lovely assistant. Hi, Ryan. So she was just telling about her fun adventures on the farm today. So during the coronavirus, she gets to work on a horse farm. And today she was chasing after cows. So, good day. All right, so we're going to start with some foam rolling. So Ryan's going to sit up on the foam roller, cross one foot over the other, and start the foam rolling. So today we're going to be doing very similar to what we did last time with a minor modification to one of the exercises. And then there's just going to be a little bit more talking about the specific reasons for these exercises. So go ahead and switch, Ryan. So with the foam rolling, I've talked to you several times and even have a little video on it. It's to warm up the tissue. I just had a patient today who had a virtual patient who had an injury to his calf. He's a runner. And I was talking about the importance of making sure you get the different angles on the muscle. So during these instructions, I have talked about tilting your body, as my daughter is doing, and also changing the angle of the foam roller. And go ahead and switch. And the important part here is that it's not the exact same position. I'll go to the gym, for example, and I'll see people foam rolling their hamstrings like my daughter is, and they just kind of keep going back and forth without getting the different parts of the muscle. And so the point of foam rolling, in my opinion, is to stimulate the blood flow to the area. The notion that it's breaking up scar tissue or it's releasing adhesions and things like that, that's never actually been shown to be true. Go ahead and switch. So anytime you do massage type things or foam rolling type things, you're definitely going to be changing the circulation on the muscle. And there's probably some things happening just from the neurological end of things that's some tension areas are being released here. We do a lot of manual therapy at the clinic to get the muscles to release their tension. And there's a few reasons for tension in the muscles. The number one reason, I believe, is protective. So your body tenses up to try to protect you. And go ahead and switch. And so what we're doing here is we're trying to release any tensions in the muscle, and we're trying to get some new circulation in the muscle. And as I've mentioned in the past, there's some studies that show you'll have an increase in tissue mobility and joint range of motion after foam rolling. And so what that would suggest, if you're noticing an improvement in your tissue mobility or the joint range of motion, it means that those aren't a true restriction. So people often say they have like arthritis in their knee, and it's maybe true they have arthritis in their knee, but doing foam rolling would have no influence on the range of motion. Go ahead and switch, meaning that it's not arthritis that's causing the stiffness, it's tightness in your muscles, which can indirectly be caused from something like arthritis. So our body tries to protect us and therefore tenses up. There's also a notion of increasing flexibility, and this is one of my kind of pet peeves because the muscle attaches in one part of the bone and then it goes and attaches another part of the bone. The length of the muscle is never actually changing. And even the studies will show after prolonged stretching activities like weeks or months of stretching, then you'll see at most, go ahead and switch, you'll see at most a couple millimeters of change in the tendon length, which means, yeah, it can get a little bit longer. But what I think is happening more is that the tension in the muscle is being released and it's allowing the brain to relax and say, okay, you can go further into this range of motion. So in the clinic, I'm always starting off, I use an expression, mobility first, stability or strength second, and then flexibility third. And so mobility means joint mobility and it means soft tissue mobility. That should be your starting point, period, in my opinion. Go ahead and switch. And the more mobile your tissue is, the less likely you're going to have stiffness in your joints. Now, if you have degeneration in the joints, the range of motion won't change, and if it does, it'll be a very mild change. So, because the degeneration doesn't go away. So I have a finger that has quite a bit of arthritis in it, and no matter how much I will it to get more bend to it, it just doesn't. So I can do a lot of manual techniques and force it, and I will gain a little bit. Go ahead and stop, Ryan, and we'll go into the marching. So my point is that if the degeneration is a true degeneration, then you can't make it go away by doing stretches and otherwise. So I always want to maximize the joint mobility. So even if you have degeneration, I want you to try to get your joints to their maximum range, nothing forced, nothing hypermobility or anything like that, but just the maximum amount of range of motion you can get, and then I want you to maintain it. So as I've mentioned, we've been doing foam rolling at the start of every session to get the tissues mobile, and it also has the byproduct of helping to get your joints more mobile. And now the marching that we're doing here is to warm up and prep for running specifically. And so these are those running muscles that we're warming up. And you'll notice as this progresses, if you pay attention to my daughter, that she's standing a lot more tall as she's doing this. So we're week 2, day 3 in here, and the technique is improving through repetition. Her stability on her feet is also better, not shaking quite as much. She has more thoracic rotation in both directions. And this is just doing it 3 times a week, or in my daughter's case, 5 times because we lose the video and have to redo it. But for you guys at home, you should be noticing also some improvements. These things get a little bit easier to do, and yet they're going to remain our warm-up, a 5 to 10 warm-up before you start strengthening. You guys might notice the cones there. That's my way of telling how far to go so she stays in camera. Sarah, who does medical therapeutic yoga, has a video for runners, a yoga flow, and the next edition of Saratoga Today, which will be the week of October 13th, that Friday, the edition will have yoga poses for the runner. And it's just a bunch of photos with a brief description of the exercises. I believe last week's, or I think it was last week's, last week's Saratoga Today, I put out exercises for runners, and they're slightly different than the exercises we're doing here. However, there will be some in the last week of this program. We'll be progressing some of the exercises, and we'll get into them, some of those. Very nice. So I was much better with my timer today, and that was about 8 minutes of a warm-up. So Ryan's going to put the band on her knees, and she's going to grab one kettlebell, the little one probably, and lie on her back. And so we're going to continue doing this particular exercise. If you're finding this exercise is easy for you, then what you would want to do is you would want to increase the band. So if you have another band at home, you can either double up or make the band stronger. Another thing you can do is while you're doing this, so Ryan, I'm going to have you bring the weight up toward the sky, to the ceiling. Good. As your knee goes out, your hand goes overhead. Good. So it's just another little addition to make it slightly harder, and somewhat harder just on the brain, so you're concentrating, because I don't want that pelvis to move. So when we add movements in the limbs, we still want the core to be stable. So after she does 10 repetitions with the right, she's going to do 10 repetitions on the left with her left arm, and then we'll go back through and do it opposite. So she's doing same side right now, and then I'll show you how to do opposite sides. So notice that she dropped her right hand to her hip, which is fine to do. And if you're having a little difficulty with the stability, so this is again, her stable side is the right side, so that would be the harder one for her. So by adding this dynamic movement with the arm, it's challenging that stability. So by placing her right hand there, it's a cue to the brain to fire those muscles. And it's one of those neat little things you can do if you're trying to activate muscles. Just literally touch them. Put your hand on them and hold the specific muscles you want. And it's a way to influence the neurological feedback there and improve the activation. So now she's going to hold it in her right hand, but she's going to do her left knee again. So now we're doing the opposites. So the first one was the same. Now we're doing opposites. And the whole point here is to not let that core move. So sometimes slowing down a little bit, controlling, sometimes not going as far in the range of motion, and sometimes it's just flat out too hard. And so if it's too hard, stop moving your arm and just hold it still. If it's still too hard, put the weight down and just put both hands on your hip bones and really concentrate on that. So the progression of forces, it's a way to increase for those who are finding the exercises easy, but if it's not, it's okay to just stick with the one that you're doing. And every time I progress something, you can try it and see. If you know that you're already struggling to do it without any weight, then obviously you don't have to start moving your arm around and just stick with the one you're doing. This was the hardest part of me for developing the program, because usually I'm seeing people one-on-one in the gym setting, and in the gym setting I can progress based on the individual. So here I'm trying to incorporate for a multitude of runners of different strengths and abilities. So that's why I'm adding the differences, the layers to it. I have one runner right now that I've worked with for close to a year, and it's been a lot of fun because I've been able to get into his real specific weaknesses. And so Ryan's going to take off the band, and it's led for him to have no injuries in the past year. Any little mild hiccup we had, we were able to address. So Ryan, let's grab the weight again for this one. And, oh, nope, sorry, put the weight down. So you're going to go up into bridge and bring your right knee to your chest, and we're going to hold for a 20-second count. So we're going to do this for one set, Ryan, and then the second set through we'll progress it a little bit. So we're doing a 20-second hold on each side, and then we'll go into the side planks. So my gentleman, the runner, he has improved, and his speed has improved. His ability to run from 5Ks to 10K race, I should say, he did his first 10K race, and he did quite well. He didn't do as well as he'd hoped, but he did well. Good, switch. But on his 5Ks, his times are excellent, and again, the injury rate is down. So he came to me originally with a knee pain, and he hasn't had knee pain for quite some time. But also no other injuries. So remember, the number one reason for an injury for runners is having had an injury in the last 365 days. So I'm very optimistic that we're going to be able to maintain that. And he's been doing a lot of strength training, and I've been able to progress him to more dynamic things. And then as the season approaches, we resort back to these type of things. Go ahead and switch. So these type of things was a terrible explanation. These type of things she's doing right now, which is core stabilization exercises. So a lot of times the runners overlook the value of staying consistent with isometrics in particular. And then obviously I've mentioned the last several times about the foot. So when he comes in, I'm making sure his program always includes isometrics and footwork. Good, and switch. Oh, I know why it's harder for you. Guess how long I was holding you up? 30 seconds. Sorry, Ryan. Sorry for those at home who are like, why the hell does this feel harder today? I'm going to make you do 30 in this one, then we'll go back to 20. Now I know you can do 30 seconds, though. That wasn't planned for this week, sorry. Oy vey. Good. This one will be for 20 seconds. Now you want to do 30 though, don't you? No, she doesn't. She'll yell at me when you're not in camera. She's very mean to me in private. Not really. Not that anybody believes it. Good, and switch. So after this one, we're going to switch to side planks. Go ahead and switch. We'll go to side planks. So we're going to keep holding for 15 seconds with side planks for right now. Bring your hip down slightly. Good. So these side planks I have people doing from the knees, and next week we'll be progressing to make them considerably harder. So go ahead and switch, or rest rather. And the side plank I like a lot because we're working those lateral abdominal muscles. The area that I'm not a big fan of for side planks is the shoulder area. So if you have problems with your shoulder, it's okay to not do this, or certainly not do it as long. And there are other ways to do planks. In fact, the program that Sarah has for yoga, she did side planks from the feet. Go ahead and down. And I know a lot of people are used to doing them that way because that's how they do them in yoga. But I like this way because this isolates down more to the core, so you're not actually using the whole leg. So when you're on your feet, you get to use your thighs to help out, and even your calf muscles to help out. Here you're really getting down just into those core muscles, hip, pelvis muscles. Go ahead, switch sides. And so this side seems a little bit more stable. Than the other one. Which is her more dominant side. Switch down. I'm terrible with the timer today. And up. Good. I'm like that cat with a little laser pointer. All right, and down. We have one more to go. Good. So if you've been doing these exercises on Monday, Wednesday, Friday, today is your Friday, and that's the night Orion and I go watch TV together. We're TV buddies. Good. Let's go back to the bridge. And so this time, Orion, I'm going to have you hold your hands up. So we're still doing the single leg bridge. We're still going to hold for 20 seconds. And now with the hands up. This makes it considerably harder. So when your hands are not down, then it makes it more isolated to those core muscles. You don't have the stability from your upper body to help out with. So I think this is harder than even holding for 30 seconds. Would you agree? Yep. Go, switch. So remember, when both feet are touching the ground, you're resetting. And we may find that this is too difficult with the hands up. And if that's the case, there's a couple scenarios. And the number one scenario would be to put the hands down and then hold for longer. So I think that's what we're going to do instead of having the hands up, Orion. So go ahead and stop. Put your hands down. Let's go to the 30-second count. So when you guys, if you go and see the video that we just did, or this last one, you'll notice that Orion was having a hard time keeping her pelvis square. So remember the level, if I took a level like a carpenter's level and put it on the hip bones, it would stay parallel or level. And so when you take the hands out, she doesn't get to use the stability there, which requires more work on that pelvis to hold it still. So with her right side, that's the harder side for her, it's harder for her to hold that position. Good, that was 30 seconds. And so we'll do this side for 30 as well. So if you're finding that you can do this for 30 seconds and keep your pelvis level like hers is now, then you can start to put your hands up. But I'm going to guess that most people are having a hard time keeping their butt up and their pelvis square doing this even for 30 seconds. So we'll stick with that for this next week too. And I'm saying it out loud so Orion helps me remember in case I try to do it otherwise. Good. Let's do one more round on each side. So this, there's another way to do this particular exercise. Orion, bring your right knee towards your chest a little bit more. So holding that muscle, the right leg in more, will work some more deep core muscles. And I like to do it the other way at 90-90. It's just my preference. But you can progress this exercise also by bringing that knee in a little bit. It just makes it a little bit harder on that psoas muscle to hold it in there. Good. And then switch. So after this rep, we're going to go back to the side plank again, and then we'll get some standing exercises going. Good? So back to side plank. Good. So these lateral muscles on the right side to help hold this position properly. Remember that the pelvis should be forward. It almost feels a little awkward when it's forward, so that your shoulder, hip, and knee is in a straight line. Rest. And Orion, when we do the other side, I'll have you have your knees towards me. Go ahead and go up. So that we can see that picture, or see you from the side. So from this angle, I'm looking to make sure that it's a straight line through the torso, so that she's not, rest, so that she's not arching her side. We'll do one more time with this side. Good. Bring your right hip down slightly. Bring it back up. Bring it, no, I'm just kidding. Okay, and stop, and we'll switch. And so have your knees towards me. So again, we're looking for that straight line from the shoulder to the hip to the knee. And that pelvis is forward when she's doing this. And that's how you maintain that. Good. And then back down. Pelvis forward a little bit. Good. So to get your pelvis forward a little bit, you usually can squeeze your butt cheeks a little bit to drive the pelvis forward, or you can engage those deeper core muscles, depending on where you're tilting from. Good. We'll do one more round, and then on to the standing. Pelvis forward a little bit. Good. So if you bring your pelvis too far forward, you're going to arch your lower back, and that's not the purpose of it either. So we try to be as straight as we can, where we're engaging those deep core muscles and engaging hip pelvis muscles, I should say. Good. Come on down. So let's put the bands on the knees, above the knees rather, and you can also put the weight vest on. And we're going to start with the lateral toe taps. And we'll do 2 sets of 10. So one of the things that I'm just realizing, that another way to progress this is actually repetitions, but I'm going to stick with the 2 sets of 10 for right now. So we're going to do 2 sets of 10 of lateral toe taps. So I had mentioned at the start of this that I would talk about why we do these type of exercises. And for this particular exercise, we're working on the glute muscles. So a lot of times people feel the burn in their butt area. But also by having that knee bent, you're going to be working on the thigh muscles as well. So it's like a single leg squat, a partial squat, and then you're balancing on your foot. So I've had Orion take off her shoes for the last week so that we're working on the muscles on the bottom of the foot. We're working on the muscles in the foot itself and in the calf area. So ideally, if you're at home, to do it in stocking feet or barefooted to get that foot contact. And then what we're trying to do is we're again trying to train that stability. So when you land, when you run, there's a little bend to your knee. So if you're a heel striker, you start off with a straight leg, but it immediately goes from that straight position right into a flexed position. And as you roll over it, you're going to be putting weight through one leg at a time until the other leg comes through on the other side. So we're trying to train those glute muscles to hold that pelvis while you're on one leg. And by doing that squat, we're still working those thigh muscles. And both technique, we're making sure the knee doesn't come in over the toe there, so it's staying nice and stable. So this is one of my favorite exercises for runners because it incorporates so many different things. You can take the bands off. It incorporates so many things into one single movement. And then, as I've been saying all along, is you want to continue to load this. So technically, these two exercises are, you're touching 2 feet on the ground, but most of the work is being done by one. So this is a way to challenge a little bit of balance, so you're focusing more of the work onto one side, but not so much that you're truly doing a single leg activity. And I like to have the toe tapping just because it is a little bit easier for balance, but you're still going to get a lot more work. Like right now, that left leg is working hard to do this full range of motion. And so even though she has her right foot down to help with balance, the majority of the weight is through the left leg. And I also like this staggered stance type of movement because you can adjust the foot. So if you have one leg that's weaker than the other, then you can just bring the foot closer to the leg that's doing the work. So in this case, she can bring her left leg back to help support the right one a little bit more. But the goal would be that if this particular position is too easy for her, then she would just start to move that heel away from the toe. So her left heel would move away from her right toe, and that would make it more challenging. And you want to be in the range where you can complete right around 8 to 10 repetitions. We're doing 10 here. If you find that you can do 15, then it's just flat out getting to the point where it's too easy and I'd want to increase your load or bring that foot further away. So I'm not sure you can notice in the video, but on this left leg, her heel is out a couple inches away from the left big toe. So her right heel is away from the left big toe. That's because her left side is stronger than her right. And on the last time when she's doing it, she had her heel closer to the toe, which is acceptable. It's exactly what I want you to do. I want you to be successful maintaining good form, but the instant it starts to get easy for you, I want you to make it harder. And there's a whole bunch of ways of making it harder. For example, adding more weight. Number 2, with this exercise, bringing the foot further away. Number 3, you can get the foot right off the ground so you're truly doing a single leg exercise. And there's other ways to make it harder beyond that also. But this is actually by switching the weights in the hands is another way. Throws your balance off, challenges more. You can lift the knee up as you're going, so there's a lot. You can keep progressing. So now we're going to do, you're going to do the star, and you're going to hold on a weight. So you hold it at the chest, yep. So for this time, the progression is going to be the star, and we just added a little bit of weight. She's going to do 5 repetitions on the right side and 5 repetitions on the left side. But the second set, we're actually going to go onto the yoga mat. So we'll challenge the balance and get rid of the weight. And I can tell from the time I'm going to go over 30 minutes again. So this is no longer a 30-minute workout. This is going to be a 30 to 35-minute workout. Orion's going too slow, so not really. Every time we start the workout, Ryan tells me how cold it is in here in the gym. And every time we're done, I can tell she's not cold anymore. So, which is cool. I'm cold. Maybe the last one, Orion, I'll do the exercise and you talk. You talk me through it. No, that won't be happening. These are all way too easy for me. I need a challenge. Yeah, sure. I think I moved our camera a little bit. Sorry if that makes you dizzy at home. So next we're going to go do the toe walking. And then we have one more round of the floor star, and we'll do that on a yoga mat. So the distance she's walking back and forth in the camera is about 10 to 12 feet, and I'm looking for anywhere from 15 to 20 steps. So if you're doing it at home, be in that kind of range. Good. So Ryan, let's fold up the yoga mat. Just let's fold it in half. And then just put it out there, yeah. So I'm only going to have her fold it in half. If you still, nope, no, wait, just let's go with the unsteadiness of the yoga mat. So by standing on the yoga mat, it's going to challenge the foot and ankle a little bit more. And it may be, yeah, that's okay. It's a little harder? Yeah. So if you're finding that it's still not that hard, then you just fold the mat again. So the more the cushion underneath, the more unsteady it will be, so the more work for the foot. So I like to see the foot wiggling and woggling a little bit because I want that coordination in those muscles, and I want that strength in the calf and the foot muscles themselves. And remember, when we're doing these kind of things, we don't want the toes to dig down into the ground. You can kind of wiggle your toes a little bit so that the base of your big toe is what's in contact, and the base of the little toe and the heel, so that tripod. So if you're running and you're noticing that you're getting a callus or you're getting a rubbing on the tips of your toes in particular, that means you're gripping for sure. Another sign that your footwear is off is you're getting a callus in between the second and third toe instead of on that big toe. And that usually means you're not actually rolling over on the big toe as much. You're putting your weight through your second and third metatarsal. And one of the more common areas for a stress fracture are in those two bones. And it has a lot to do with the shoes you're wearing and the type of striking you're doing on your foot. So if you do get a callus in that area, just know that your toe box is probably too narrow and you want to get a little bit wider toe box. And another possibility would be that your gait is off a little bit when you're landing and rolling through. So after 5 on this side, we're going to do one more round of the toe walking. And just as a final cue here, just remember that you're trying to stay up high on the toes, so your heels stay way up in the air and try not to let them come down at all. There are times where I use this as a warm-up as well. So just keep in mind, like I've been saying for the last week here, that you want to make sure you're addressing the muscles of the foot and the calf muscles. Those are big players for runners and often overlooked in training. And obviously I'm talking a lot about single leg exercises, and with my lovely assistant you can see why. So she doesn't have any aches and pains, and she can run marathons and sprints, and she wouldn't run well, maybe you should run a marathon. But my point is she doesn't have injuries that way. So, all right, everybody, that is week 2, day 3. Let's call it a wrap. If you have any questions you'd like to ask me about, call 518-306-1225. You can also email me at physiofitpt@gmail.com, and or you can go on to our website and look for more videos. Like I said, we're putting a video up every week as an instructional video. We had balance for this week 2. The next one, I am not positive. I am debating about 2 different things. So I will make sure something's up there though. And hopefully you guys are enjoying this. Please feel free to comment, make suggestions, recommendations, all that. I am definitely open to criticism, and I want to make sure this is worth your time. I'm having fun doing it. I think my daughter's enjoying it as well. And so we are going to go out for a run now. Not really, we're going to watch TV. Bye, everybody.